Okay. Oh, thanks to Rashid for sharing that story.
Yeah.
And there are several psychological issues that could cause one to feel a range of emotions. But we'll talk to Dr. Adolphe Bequin, who's a clinical psychologist with Methodist University College. And of course, Dr. Senyo Mizmarame is here, our resident doc. Good morning, good morning.
Bonjour.
Bonjour indeed. Okay, so Rashid shared his story of depression and all of that. But we want to focus a lot today on another psychological issue, which has to deal with anxiety and panic attacks, which some people might not really know much about. So we just want to educate ourselves this morning. Maybe you can even distinguish between feeling depressed and having anxiety or panic attacks.
Well, well, thanks again to Rashid. I'm sure he's touched so many people this morning, and his last message of hope is very important. I don't think it's worth it ending your life for any reason. As long as you live, opportunities abound there. No situation is permanent. No night is too long that it doesn't have space for daylight to come. All right, so that is for you guys. And I know that today we're talking anxiety, panic.
Yeah.
Depression is just a sadness of mood, like, you know, really, really, really sad. We said that in lives, in our emotions, you could be very sad and very happy. All right. Now, when the sadness is really, really bad, you are depressed. When you are too happy is something else. All right. So in that spectrum, when there's profound sadness of mood that is beginning to gain an effect on the human body, then we'll talk about depression. Now, anxiety is this worry or nervousness of an emotion that is associated with the uncertainties that a person perceives for either the immediate future or the long-term future. That is so different from fear, which is the reaction that somebody gets, or the same worry or the same worry or emotion that they have for a threat that is present. All right, so there's a distinction. But when we talk about anxiety disorders, because you mentioned panic attacks, then it involves emotions that have to do with both anxiety and fear. All right, so the distinction is a bit difficult. So we are trying to say that, for instance, if coming on this show made me feel a bit worried, I haven't really
that happens to some people.
Yes, I'm not prepared. What am I going to say? How about standing people on TV and all of that? And that began to make my heart race fast, made me start sweating, especially in my palms, made me a bit jittery, stammering and all of that. That is considered some level of, that's considered anxiety. All right. So having uncertainties about something that you perceive and you cannot cope with well. So it's a bit of like not getting the right coping mechanism for a situation you perceive. And then that begins to have a little toll on you.
All right, Doc, can you expand on that a bit for us?
I think that we need to distinguish between positive anxiety and negative anxiety. Anyone who has achieved anything, any feat, has gone through some anxiety. Every achievement is transcending your anxiety. And anxiety is a universal experience we go through every day, and it is also adaptive. It is very adaptive. I mean, and that takes us back to our forebears who had to live with danger every time. If you were not anxious, you wouldn't mobilize yourself to be able to deal with that. So we need to make that distinction. But I want also to look at the continuum he raised, that range of emotion on the continuum, the spectrum of emotion. Sometimes anxiety and depression coexist. We call that comorbidity. They coexist. And oftentimes it is masked. We are unable to disentangle them. It so happens that someone who has gone through depression also at a certain point would have anxiety. It is the same brain region that these emotions emanate from. All right. And I think that it's very important that we take note of that. And the current diagnostic procedure really do not distinguish so much. They consider them as a coexisting, and anywhere you see depression, you must also be on the lookout for anxiety.
So I know Senyo listed some things that, or some should I say, the way it manifests somehow.
Yeah.
So, but then someone could say, oh, but it could be transient, like Patrice was saying, or like you were saying, for just that situation. The person's coming on set, so they get a bit anxious, but it's done. It's like, oh, okay, that's done. I can move on.
Gets back into the mood.
But are there situations where it becomes a chronic thing, and then, you know, how do you distinguish between that and treat?
Anxiety could be very transient, like you've mentioned, and then it could also be chronic. I just want to mention one thing, and then we can build a point from there. If someone tells you that, in our local parlance, say owa kauda, usru. All right. Yeah. Now you will understand. All right. So
after a snake is biting you, when you see a worm,
like maybe once bitten, well, not in that sense. So from there, all of life's experiences, things that have happened to you, growing up, stuff, deaths, seeing accidents, seeing things happen on the news. All of these things go into the human body and give you and inform how you behave. All right. Now, when some of these things begin to eat you up bit by bit, and you are so afraid of certain things and how you cope with them, not even just the fear alone, but how you cope with a certain situation. Some people can stay with that over a long period. So rather than having maybe a certain anxiety because you're going to write exams, which is just for that period, there's somebody who is always anxious about one thing, and they get the next one to be anxious about. For instance, there is a situation in my field, for instance, where people would come and they are worried that their heart might fail them. They're worried. Just worried that their heart might. So they come, I get this palpitation, and I don't know why. And then you do an ECG, you do an echo, you do a chest x-ray, and you tell them there's nothing wrong. And then they come back and say, oh, anytime I start my car engine and it makes that noise. So for that person who's had not what we consider normal anxieties lasting for a longer period. In this case, there's no time frame, but usually I use anything from 6 weeks and above for people. I don't know about
something
you.
But
currently they look at even 6 months.
6 months, all right.
Yes. For 6 months.
Then it has become a chronic problem. All right. So you can have chronic anxiety, just to answer your question.
That is pretty serious. But how does it affect your mood? How does it affect your delivery? How does it affect the way you relate to people?
Yeah, it is a disorder. Only as anxiety becomes anxiety disorder, only when it is disabling. It is preventing you from doing your daily function. It becomes so dysfunctional. You wanted to come on set because you feel so shy, you feel so fearful, you are unable to come. It means that it is really disabling you. In that sense, you have, and if it has persisted in many settings, then you have anxiety disorder. But one thing that I would want to highlight is that in anxiety disorders, particularly our cognitions are very important. Our cognitive frame, very, very important. It is often said that what the dog sees and barks, the cat sees and it just
stays calm.
You can be with someone in traffic. You are always, both of you are confronted with the same situation. One remains calm, one becomes panicky and all that. So when you observe a threat, when there is a stimulus from the environment, we will interpret this stimulus differently based on so many factors, based on our personality, whether you are type A or type B, or you have some irritability. You will interpret that as a threat, and the moment you interpret that as a threat, a whole neurochemical reaction takes place to prepare you to deal with that.
So let's say, even academically, how does it challenge you? For example, you're going to write an entrance exam, and everyone's like, Charlie, we have 3,000 people, and they're going to pick only 20.
That naturally brings a lot of anxiety
to anybody. Like
competition brings a lot of anxiety.
And is that a good one or
positive?
Well, if that anxiety spurs you on, to prepare adequately, to arrange yourself in such a way that you will not fail, then is a good thing.
Positive.
Right.
Okay.
But I tell you one thing, when the mind perceives certain things, all right, and it begins to produce chemicals that affects the rest of the body, then we have a problem at hand. All right. So for instance, if that anxiety is translated into increased heart rate, it's translated into fast breathing, it's translated into going to urinate, frequently. It's translated into feeling like passing
it could be that bad.
Oh, yeah. It could be really, really that bad. So when those things happen, then like he said, is beginning to affect your normal functions.
Then it's a
could
disorder.
also affect your social life or your social circumstances. Then it becomes a disorder. And like I said in the beginning, when anxiety, that feeling of worry or of uncertainty, or being unable to cope with a certain situation, whether it's real or just perceived, is coming with fear as well, then that's where there's a problem. For instance, if I thought that this exam would be tough, they're going to take 20 people, and so you find me always, in a panicky mood, but going to study all the time. Do you have this Pasco? What is going on? I'm panicking, but I'm actually doing something important. But if that made me fear so much that everybody else would be like, why are you so scared?
So the police officer takes your driver's license, and every time you see a policeman,
So, and when we talk about anxiety disorders, certain phobias also come into the fold, which is an irrational fear of something or a situation. You understand? So if you have that kind of anxiety around a situation, a thing, a person, and all of that, it makes you so fearful, and you can't even explain. Sometimes a person who is suffering from these things will be like, I don't know why this particular situation makes me so anxious. But every time I see this gentleman, just because he said so and so to me before, when I see him or see someone coming like him, then my heart rate goes up, I'm sweating, I don't know what to do. It becomes a problem.
What about emotional? For example, you feel good about somebody, you are attracted to somebody, but you can't tell them. And whenever you see them, you feel a certain way.
Well, it's a form of social anxiety.
Okay.
How you don't have the capacity to relate socially. Okay. And so whenever you see, we used to call them POP. They are unable to relate. They don't have the social skills. And that can really also affect them. You want to relate, you can't relate, so you are isolated. And there are some people who really find it so difficult going out to social settings. They won't go to a party, they won't go because the fear is that I'm going to be judged. And that notion of being judged.
Being judged, as to whether you pass or you fail,
what are people going to say about me? Do I even look nice? Am I looking presentable? And all that is going to affect them. And so they will stay. Sometimes they don't even go out.
So invariably, for people who always dress up and they ask around, am I looking good in this? Is my shoe okay? Is the color okay? Is that some form of anxiety?
We need to be very, very careful not to just lump every evaluative setting as anxiety. Well, you can ask opinion. You can ask for opinion. But if it is persistent, it really also highlights something about you, where it's a confidence. Do you believe in yourself? And it may also be some form of there may be some disorders coming up, what we call body dysmorphic. You are not too comfortable with the body that you have, and so it is preventing you from going into social settings. So we need to look at that and see what can be done about it.
Just a quick one. You see, when you take normal anxiety, we can just say normal anxiety and then talk about anxiety disorders. So some of the situations that you are mentioning could involve anxiety, and that is like on the normal scale. Is my hair looking okay? I shave my own hair, so I'll be like, can you check my back?
Maybe you're going to an important event, and just for that.
Those anxieties are considered normal.
Okay, so let's talk to Enoch and come back. Good morning, Enoch.
Good morning.
Hi.
Yeah, thanks for calling.
Yeah. Please, I want to know how one can overcome anxiety.
Thank you.
We'll definitely talk about that.
That's beautiful.
Yeah. How to overcome
How
it.
one can overcome.
Yeah, before I hand over to the expert, we mentioned that when there's perceived threat and someone feels inadequate in coping with that threat, I say threat here as in any situation you face, with, not so much of maybe physical threat, but anything that you perceive that you're uncertain about is a threat, and the way you cope with it, will show whether you were prepared for it, you can go through it or not. Now, when people do not have the coping skills, then they may, show signs and symptoms of anxiety or its disorder. So, one of the ways to cope with anxiety is to be able to train yourself, or maybe have somebody train you to face situations.
Who will train you?
So, for instance, I'll give you one scenario. For instance, people who go into the army, all right, are people just like us. They are made to go through situations on a daily basis during training. Simulations are created to make them feel how it will be like to be at the war front.
Right.
All right. Those people are being prepared up here.
Okay.
Which is one of the things that my friend here does, which we call cognitive and behavioral therapy in a broad sense.
Right.
So anybody who can prepare themselves adequately to face perceived situations will be ready.
Okay.
All right. And so that's one of the ways of dealing with it.
Okay. Dr. Bakwe, can you give us some coping mechanisms that people can employ?
Yes. First and foremost, there are some cognitive distortions that we have. For instance, if someone says, nobody likes me, nobody loves me, and for that reason, going out there, he becomes apprehensive. There is no basis for that assertion. And so what you do is to really defute that. Ask yourself, step out, and see whether people will not, when you smile, people will not smile back.
Okay.
So if you are in your little corner saying that people don't like me, and so you become apprehensive, you are doing yourself a disservice. And there is no scientific basis for what you've done. There is no data. It's just irrational. So you step out, smile, extend your hand, and see whether somebody will not help you. And then we have what we call the systematic desensitization, especially where there is some fear object, something that you are afraid of. You may have been conditioned, either accidentally or deliberately by someone. Now, if you went out and you met a dog,
That's
you
a
met
good
a
one.
dog, you are walking with your mom, a child, and your mom screamed. Remember, it is not the dog that made you afraid.
It was the reaction of
screaming of your mom.
Okay.
So, but you are going to pair the screaming with a dog. So now dogs taunt you. Anywhere you see dog, you remember the screaming of your mom and you become afraid. That means you have been conditioned. There is something called classical conditioning. You have been conditioned. You've learned to be afraid. And you can unlearn.
So you've learned to be afraid.
I like that.
It can be unlearned. And that is what must be done. For instance, you are afraid. And we will let you list in a hierarchy form the things that you...
Sorry to interrupt you. There's Jessica on the line to ask a question. So, Jess, good morning. Hello.
Hello.
Good morning.
Good
Yes,
morning.
good morning.
This morning.
Hi.
Okay, I have
Jess.
a question for doctor, please.
Okay, what do you say?
I have a question for the doctor.
Okay, go ahead.
My question is, anytime I get pregnant, I have this anxiety that I might lose it. Is it normal?
How many times have you had your pregnancy? How many children do you have? How many children do you have?
I've lost 6 pregnancies and I have 2 children now.
Okay.
So that's probably why, because in the past she's been through.
We've discussed here before, how to cope with a loss and dealing with a new pregnancy. And we mentioned that the way you were helped through the loss also forms grounds for you to be worried about your next pregnancy. I get that a lot. Even for people who've known about other people's losses and are well informed, maybe just by reading something or hearing somebody's experience. Like Doctor said, that person has been conditioned, or they've gone through a life experience, like I said earlier on, that makes them fear that what happened could happen again.
Yeah.
So there will be a lot of anxiety. But having said that, which is one of the things I wanted to mention, there are certain conditions that generally would make somebody anxious, and they are medical. Pregnancy is one of them because of the hormones that are produced. Some of these hormones work through the same systems that would cause you to be anxious and fear and all of that.
For somebody like that, how can they overcome that fear?
How can you help
Now,
them?
this person needs to be counseled.
Okay.
Right. We take them through, for instance, in her case, at what stage she lost the previous pregnancies, what was done for her during that period, did she have proper counseling to cope with the loss? If not, we could take her through. When we know the stage at which she lost the pregnancy, then we build milestones for her.
Right.
For instance, you lost the pregnancy at 3 months. So the anxiety is allowed before 3 months. So we help the person. Every visit we go through, your baby is fine, there's nothing wrong. In the other pregnancy, they might have been bleeding around it. Today, there's no bleeding. So you help the person and support, reassure the person. Now, immediately they pass that milestone where they had that loss, most of them would have recovered. And then they look forward to seeing their baby.
Do people ever have to take medication for this, Dr.
Absolutely. A combination treatment. Yes, you can be helped with medication, and then also psychotherapy. That is the cognitive behavioral therapy he talks about.
Doc, where are you located?
Well, I'm with Methodist University. I teach at Methodist
University.
And, yes.
Oh, well, I don't know if that is the most appropriate place for people to trace you, but if you want to, ask any questions with regards to what is going on, you have any anxiety or fear or something that bothers you, you can reach out to Doc at Methodist University. If you want to put it out there,
he's like,
you've been inundated.
I know.
It's not about being inundated. But there are also ethical principles around some of these things.
All right.
Yes.
So
that you need to be very careful about.
Okay, so they should just look for you at Methodist University if they need to.
And go and see Jigwe, Dr. Senyo. You all know where you can meet him. Tantra, his number's been on the screen.